So we will start by reviewing concepts in chapter 20, chapter 21, chapter 22, and chapter 31. Chapter 20, Family Development and Family Nursing Assessment Genomics. So for each chapter, ensure that you look at the outline, be able to describe or explain or answer the objectives. So for chapter 20, we'll talk about genome, genetics, echo maps. What are you assessing when you go to someone's home? Our big idea is we're promoting health. And in order to do that, we have to be able to communicate effectively. We have to know when to advocate. We need to know what are those advocating skills. We have to have good writing skills. We're mapping out. You need to think about what are the health trends? What are the family dynamics? So you're going to look at the client and the family. We're blending public health and family. We're going to work cooperatively. We're going to wrap around the approaches. We want to consider education, environment, who are the people? What are those roles of each individual? What is that family's function? Knowledge of family functions and structures is essential for understanding how the families, who influences what are those influences of health and illness and well-being. Family functions are the ways in which families meet the needs, each family member, the family as a whole, and in their relationship to society. So in box 20.1, is just some different roles and structures of families. Family structures have changed over time. And so in order to meet the need of the family in society, we must keep that in the forefront of our mind. Despite the focus of family health and nursing, the meaning of family health lacks a consistency and is really not precise. But the term family health sometimes is used interchangeably with the concept of family functioning, healthy families, and familial health. So when we talk about healthy families or dysfunctional families versus functional families, a dysfunctional family, you're looking at whether that they are compliant or not. Compliance versus non-compliance. Are they motivated? Do they have the coping skills, or then they don't have the coping skills? So for a dysfunctional family, you're looking at non-compliance, not being motivated, no coping skills. For a functional family, you're looking at, is there a balance? Are they resilient? When things happen, are they seeking out resources and answers for themselves? Are they integrating and managing the resources that they have? So you will see levels of prevention in each of the chapters. So be sure that you are understanding levels of prevention. For primary prevention is before illness or before injury actually occurs. We're providing that education. And then for secondary, we are testing, we are screening, we're giving surveys. We are like little detectives. We're trying to find out information. And then for tertiary prevention, there is a disease process that's already there. There's an injury that's already there. How do we support them so that they can manage and cope? So be sure to look at each one of the examples that they give in each chapter about the levels of prevention for the various topics. So 4 approaches to the family. Central to practice of family nursing is conceptualizing and approaching the family from 4 perspectives. So 1 is family as a context or structure. The family has a traditional focus that places the individual first and the family second. So the family as a context or structure is that individual. Focuses is placed on that individual first. And then you have the family as a client. The family is the primary focus and the individual members are second. The family is seen as a sum of the individual family members. And the family as a system, the focus is on the family as a client, and the family is viewed as an interacting system in which the whole is more than the sum of its parts. And the fourth approach, family as a component of society. The family is seen as one of the many institutions in society, along with health, education, religious, and financial institutions. The family is the basic or the primary unit of society. So when you're approaching the family, you want to consider those. We do have some theories, but remember when you are deciding on your interventions, how difficult is it going to be? What is the deficit? How difficult is it going to be for that family or those family members to get the resources that are needed? What are the things that the community already provides? So these is some great interview questions when you are interviewing your family. Be sure to look at box 20.4 because for example, the first question, what do you believe is the most important or pressing issue right now? So while you're doing your assessment, your head to assessment of the family, you might think that an issue is most pressing, but that might not be what's most important for them right now. So you do want to identify those important issues, the things that are pressing. And these are some great questions to ask. What have you done to improve the situation? Because you can come in with an intervention and they have already tried the intervention. So you want to gather as much information as you can. And these are some great questions to help you come up with your interventions. When we do come up with interventions, we must use a system approach. We need to understand the family dynamics. What are the things that keep the family balanced as a whole, as an individual? We want to promote that balance and functionality. We want our families to be able to function. Has this happened before? Interventions should be based on the strength of the family. How can we improve and provide that support? Let me go back to page 349 here. Okay, right here, let's look at this genomics. Pattern of what the person's genes look like. When we talk about genomics, we're looking at the genetics. Genomics is a study of all of the person's genes, including their interaction with one another, as well as the interactions of the person's genes with the pairs that make up the human DNA. What is that known family history? What is the unknown family history? If that family has had death at young ages, what was the cause of the death? What was that age? And you want to look at the father side and the mother side. You want to go back 3 to 4 generations to gather information. This helps determine health outcomes. It helps you decide on the interventions that needed to be included in your care plan. And it helps you meet the family in the home and where it needs to be. Having these conversations will also help you establish positive rapport. So when you make these home visits, you want to plan for your personal safety. You want to check in at the end of the day. You want to see if, for example, if you have allergies, you want to assess or determine whether or not the home that you're going to, if they have pets, and because you could be allergic. So you do want to avoid secluded places if you're alone. You want to dress appropriately. You want to leave your schedule at work and a contact phone number. When you're interviewing the family, you want to assess the physical and the psychological. You want to design the care plan. What is needed? The equipment. How are they going to get the equipment? Who pays for the equipment? What is the developmental status? If you are providing education or teaching about a task, will that person even understand what you're trying to teach them? Can they perform the task that you're asking them to perform? And you do want to evaluate your interventions. And that'll tell you, whether or not your evaluation will lead you to whether or not you need to revise, reassess, or was that intervention okay? Did it provide and promote that family be self-sustained? Again, you can look at Healthy People 2030. These are just some objectives specific that goes along with each chapter. And it is listed in each chapter. So the next chapter we will talk about is chapter 21. Okay, family health risks. We're looking at preventing illnesses. We are assessing risk. We are trying to see how we can reduce risk. And again, with each chapter, look at the outline and be able to answer or discuss or explain the objectives. What is a family? Is there one definition that fits all families? Is there a new normal? So as we talked about previously, the family is looked at as being functional or dysfunctional. Are they able to sustain and support each other or not? Are they compliant or not? We're going to look at health insurance. How do we connect them with Medicare, Medicaid, the Affordable Care Act? I do know they just had open enrollment, which just expired on this past Friday. So we want to consider the health of the family. What are those illnesses? What are those chronic disease processes that are already there that they're having to manage? What are the services that they already are utilizing? What are the trends? Is there access to food? In our area, we just had a natural disaster. So what are those things that needed? We go back to those basics, shelter. We've had to open up high schools, their gymnasiums to create shelters because it was, it was a natural disaster, and those basic things, food, water, and shelter are those things that are needed. Now we want to reduce health risk. How do we change a negative into a positive? You want to consider where they live. Are they living near power plants? Is it a impoverished area? The concept of risk, which refers to a factor predisposing or increasing the likelihood of ill health, it is important to family health. It is important to pay attention to the environment and behavior factors that lead to ill health with or without influence of heredity. Reducing health risk is a major step toward improving the health outcome of a nation. Concepts of family health risk. The health promotion model was developed in 2019, and it has these two factors that motivate individuals to engage in positive health behaviors. One is that desire to promote one's own health. That person has to decide for themselves, hey, I want to do something about this. One is a desire to promote one's own health using behaviors that can increase the well-being of the individual, which leads to the family, which leads to the community, the population. And in the process, be able to move toward not only individual self-actualization, but also population actualization. So that one factor is promoting their own health. The person has to take buy-in. Then that second factor is a desire to protect health, using those same behaviors in an effort to decrease the probability of ill health and provide active protection against illness and dysfunction in families. If they decide they're going with one intervention or utilizing a resource and they see that is not working out for them, instead of being non-compliant, find another resource, see what else can be done. A person can reduce health risk by participating in health protecting and health promoting behaviors. It is important to understand those 7 concepts: family health risk, risk appraisal, risk reduction, life events, lifestyle, and family crisis. So for health risk, several factors contribute to the development of healthy and unhealthy outcomes. Clearly, not everyone exposed to the same event will have the same outcome. The factors that determine or influence whether disease or other unhealthy results occur are called health risks. Control of health risk is done through disease prevention and health promotion. We have 3 general categories: inherited biological risk, that includes age-related risk; those environmental risks, composed of social factors, economic and physical environments, and then behavior risk. These 3 categories of risk are discussed later in terms of family risk. When we look at health appraisals, we refer to the process of assessing for the presence of specific factors in each of the categories that have been identified as being associated with an increased likelihood of an illness, for example, cancer or an unhealthy event or automobile accident. This is the process of assessing for the presence of specific factors that might lead to something. You know, you're driving the vehicle and they don't wear seatbelts. Health risk reduction is based on the assumption that decreases the number of or the magnitude of risk will decrease the probability of an undesired event occurring. So health risk reduction, the overarching goal is to prevent that undesired event from actually occurring anyways. So looking at those interventions, and the example that they give right here is to decrease the likelihood of adolescent substance abuse. Family behaviors such as parents not drinking, alcohol not being available, and the family contracts related to alcohol and drug use may be useful. You can actually get a contract. And it's just, it can be verbally or in writing. But for the health risk reduction, remember the main goal is you're decreasing the probability of an undesired event from occurring anyways. A family crisis occurs when a family is not able to cope with an event and then they become disorganized, or we say dysfunctional. So something happens and that family are not able to use the resources. They're not able to maintain bills being paid. They're not able to get the grandma or the mom back and forth to the doctor. So something happens and it makes them non-compliant, unable to cope. Family health appraisal. Assessment of family health risk requires many approaches. As in any assessment, the first and most important task is to get to know their family. What are the strengths? What are the weaknesses? What are their needs? What do they deem to be important? Biological health risk. One of the most effective techniques for assessing the patterns of health and illness in families is the genogram. And so this is just a drawing that shows the family unit on both sides, the mom side and the dad side. And you're just identifying, those chronic diseases, the ages in which they occur. You're just mapping all that out. Completing a genogram requires interviews with many family members as possible. It is important to develop a family chronology, a timeline of family events for at least, as I mentioned before, going back 3 to 4 generations. It just gives you a clearer picture of what's has happened or what could potentially happen. The importance of environmental risk includes several identified risks. Social risks to family health are gaining an increased recognition. A family's health risk increases if they are living in a high crime neighborhood, communities without appropriate or adequate recreation. They don't have sidewalks and things and where they can actually walk and get out and have the physical activity. No, what are they to do? So, sure, they can go to the neighboring town or city, but what if transportation is not available? Economic risk is related to social risk. It is determined by the relationship between the financial resources of a family and the demands of those resources. So are they making enough to be able to buy the resources and things that they need? They have a job, but is the income enough to meet their needs? An echo map represents the family's interactions. And it's just another way of placing down who a figure, a written figure, a picture of who does what. So when that person is missing, you can look at, okay, these are the things that this person would normally do, but that person is not able to meet those needs. So then we will have to adjust, pivot and adjust, reassign roles, seek out other resources. It is helpful for the nurse to obtain certain information from the family to understand how the family views the community. Because you can come in and have this one idea and concept, and they have a total different one. Economic risk is a key predictor of health. Families often consider financial information private, and both the nurse and the family may be uncomfortable when discussing finances. So know that that's a touchy subject. The nurse will only need to know the actual family income to help determine whether or not they're eligible for certain programs and benefits. And you just need to convey that, have them to understand. The only reason we need to know this is because for this resource, it requires this amount of income. So if it's more or less, then that disqualifies you. So we don't even need to worry about that resource. We need to move on to another one. Personal health habits continue to contribute to the major causes of morbidity and mortality in the United States. The pattern of personal health habits and behavior risk defines individuals and family lifestyle risk. The family is the basic unit within which health behavior, including health values, health habits, and health perceptions are developed, organized, and performed. You have to make those home visits. Nurses work with families in a variety of settings, including clinics, schools, groups, and offices. However, an important aspect of our role in reducing health risks and promoting health populations has been providing those services for families in their homes. Because that's where they're at most of the time, other than, work. And, the reason for the home visits could be multiple reasons. You could be going for some teaching, counseling, screening, surveillance to check things out. Contracting is just an agreement between the two parties. And sometimes contracts need to be revised. Sometimes contracts are not held up on one end or the other. And then that's when the family becomes deemed dysfunctional because they're non-compliant with what they have agreed to do. And you want to seek out, why are they non-compliant? It could be just that things have changed. So the family dynamics may have changed. So roles and responsibilities might have changed. So the whole idea is to empower the family. You want to give them control, let them have some say in the decision making, be able to communicate and obtain needed resources. Again, and we talked about the levels of prevention. Be sure to look at each of the examples that are provided in the chapter. Our vulnerable populations includes the lesbian, gay, bisexual, and transgender families and teenage parents. Nurses are in an optimal role or position to fulfill a vital role in helping vulnerable populations, identifying those resources that are available. Families have varied and complex needs and problems. No two families are going to be just alike and need the same It need the same resources. The nurses often involved in mobilizing several resources to be effective and appropriately to meet the health needs of the family. When you want to look at tele home care, where telehealth and telemedicine is on the rise, they can even do physical exams now over by utilizing telemedicine. Okay. Let's go to our next chapter. Let me just scan my notes just to make sure I mentioned all that was needed. Okay. Okay. Excuse me. Okay, now we will look at the next chapter. Chapter 22, health risks across the lifespan. Again, look at the chapter outline. Look at each of the objectives. Be able to discuss, explain. Obesity rates in American children have risen to epidemic levels. So that is a huge focus. Many factors contribute to the likelihood that a child will become overweight or obese. It includes genetics, the family eating, do they, what are they eating? What are they serving for breakfast? Do they have the meals? The resources and the things that they're purchasing, are they healthy food snacks or not? We have to consider time spent watching TV. Are they just sedentary? Are there parks or there are sidewalks so that the children and the people, the community members can get out and do the exercise and be involved in the physical activity? The environment in which children live, it does influence obesity. A particular concern is the rising association between childhood obesity and type 2 diabetes. Interventions need to be based on goals of family lifestyle changes. The goal is to modify the way the family eats, exercise, and plans daily activities. We do know that First Lady Michelle Obama had the initiative, the Let's Move campaign, and it promoted a comprehensive initiative to prevent childhood obesity. Injuries and accidents are the most common cause of preventable disease and death among children. Unintentional injuries are any injuries sustained by accidents, such as falls, fires, drowning, suffocations, poisoning, sports or recreation, or motor vehicle accidents. We want to look at ways that we can reduce those injuries from unintentional causes. The leading cause of unintentional injuries in children are motor vehicle accidents, not wearing those seatbelts, driving while under the influence, suffocation, drowning, poisoning, fire, and falls. These are the leading cause of unintentional injuries. For our toddlers and preschoolers, this population experienced a large number of non-fatal falls. They're falling. They're being struck by objects. They're playing. They're developing their fine motor skills. So they're playing in the little league sports and things like that. And so this population experienced a large number of non-fatal falls and being struck by objects. They're active, and then another factor that plays part in is just their lack of understanding of cause and effect. Well, if I throw this ball towards you and you do not reach out to grab to catch the ball or move out of the way, then you will be struck by the object. So it's just that understanding. They're developing. Again, remember I previously mentioned you wanted to consider the developmental stage of the individual in the family. The school age group has the lowest injury death rate. At this age, it's difficult to judge speed and distance, placing them at risk for pedestrian and bicycle accidents. So you want to promote things like helmets and the different pads and things, knee paddings and things when they're riding their bikes. Some injury prevention topics are listed here: gun safety, bicycle safety, which we just mentioned, preventing those poisonings. So we are mandated reporters. So child maltreatment. as defined by Child Abuse Prevention and Treatment Act, any recent act or failure to act on part of a parent or caretaker that results in death, serious physical or emotional harm, sexual abuse or exploitation, or any act or failure to act which presents an imminent risk or serious harm to the child or teen under the age of 18. So yes, it also includes the failure to act. Well, someone said, well, I don't do this. I'm not really causing any harm or doing anything wrong. Yes, the failure to act is also included in it. Children are most likely maltreated by their parents, people that are not strangers. Improved medical technology has increased the number of children and just adults too surviving with chronic health problems. You know, the increase in medical technology, new new equipment, new medications, all these things have gave way to surviving, living long, healthier lives with those chronic health diseases. The ultimate goal is for children in chronic health conditions is to achieve optimal health and functioning. Nurses, we work to identify barriers for those individual families and the overall community barriers. That's part of your head to toe assessment. Identify, like, okay, why wouldn't they not take part or in this intervention? Developing support groups, advocating for improved community access to resources, and educating those working with these children on their conditions and needs will promote the family's functioning. Asthma is a chronic disease that is on the rise. The ultimate goal for children with chronic health conditions is to achieve that optimal health and functioning. You want those children to still live healthy lives. You want them to still grow. We want to identify those barriers for those families and the overall community. And again, like I mentioned, you might be helping start support groups, advocating for improved community access to resources, and educating those that are working and help taking care of the children about their needs. Asthma is a chronic disease that is on the rise. So identifying those triggers, that would be great. Asthma is characterized by excessive lung sensitivity to various stimuli. So identifying that stimuli, those allergens, things that are irritating, that will help those children stay in school. The schools might have to invest in filters. The child may need their schedule change where, especially if it's exercise induced asthma, the child may need physical education at the end of the day or the beginning of the day. You may have to provide education to the coach. But hey, this child has an inhaler and the proper use of it. In addition to prevention of acute illnesses, selected areas including smoking, nutrition, immunizations, and environmental health are topics that we just have to briefly look at. Smoking, the adverse effects from smoking, both to the person who smokes as well as to one that's inhaling the smoke, is a real factor. Elder abuse, again, we said that we were mandated reporters, encompasses of physical, psychological, financial, and social abuse or violation of an individual's rights. Just because a person's child is a person's child doesn't give them the right to go through all of their finances and just spend them. So sometimes we kind of not really think about that. Well, if they're getting this from mom or dad, but is that a need of mom or dad, or is that person really purchasing those items and things for themselves? Abuse, the willful infliction of physical pain or injury, debilitating mental anguish and fear, theft of mismanagement of money or resources, unreasonable confinement or deprivation of services. They're able to provide or to take the person to the doctor, but they just won't do it because they don't want them to get the services that are needed. Major health issues and chronic disease management of adults across the lifespan. Although there are some similarities in the health threats that adults and children share. Some issues are unique to adults. As people live longer, they need to learn ways to promote health to maintain the best possible level of health. And when that is not possible, adults need to learn ways to effectively cope with chronic diseases, in some cases, disability. In chronic illnesses, cure is not expected. So, nursing activities need to be more holistic, addressing functioning, wellness, and psychosocial issues. Again, look at all the different examples of levels of prevention. Levels of prevention are testable items for all the exams, so be sure that you look at the different examples that are there. Health disparities present political implications and influence government action. In the United States, health disparities are considered to be differences that exist among specific populations of groups in the attainment of full health potential that can be measured by differences in incidence, the prevalence, or mortality burden of the disease and other adverse health conditions. Poverty is a strong underlying current throughout all special groups. And we talked about elders being elder abuse. So the different community settings include senior centers, adult day health centers, home health and hospice, assisted living, long-term care facilities, and rehabilitation. Okay, the next chapter that we will look at would be chapter 31. Starts on page 552. And we're talking about the school nurse. This is an autonomous position. So you're pretty much working, independently. And the school nurse wears several hats. The nurse in the schools. Again, for each chapter, be sure to look at the outline. Be sure that you can explain or discuss the objectives that are there. School nursing has been around for a long time. It's back as far as the 1800s. School nursing is a specialty practice focused on providing healthcare and illness prevention to school-aged children with the goal of facilitating their participation in educational opportunities. We want a child that has a chronic health disease to be as independent as possible, to receive and experience the same, if not the same, as close to as appropriate educational opportunities as any of the other children. Standards of practice for school nurses. The professional organization for school nurses is the National Association of School Nurses. The mission is to optimize student health and learning by advancing the practice of school nursing. They have their own standards, scopes, and practices. The practice of school nursing is highly complex. No one day is alike. You might have 5 children that have type 2 diabetes, but the care that is provided or the education that is needed, more than likely is going to be different for each one of them. School nurses, like I said, function in many roles within their practice. They serve as educators, counselors, direct caregivers. They must coordinate the health care of many students in their school with the health care that the children receive from their personal health care providers. So those doctors will send orders as just though, for example, you get a prescription from the doctor and you go get your prescription filled at the drugstore. So those healthcare providers will provide orders or prescriptions, if you will, so that, the nurses will know what to do. And they practice within inside of those guidelines. Go back to chapter 31. The school nurse, we talked about the different roles that they play. Direct caregiver, the school nurse might have to administer injections, and do intermittent catheterizations, tube feedings. It'll be the health educator for both the child, their parents, the school staff, case managers, help coordinating healthcare, consultants, providing information to the administrators and the teachers and the PTO, the parent teacher groups, act as a counselor, be a community outreach nurse, researching, what are the practices, over the last couple of decades? Do we need to change our policies and procedures? And so to justify that, you have to research, find the latest research. So for Healthy People 2030, the proposed objectives are directed toward the health of children. In addition, several point directly at the care that nurses give to children in the schools. For example, one is increase proportion of students participating in the school breakfast program. Increase the proportion of schools with policies and practices that promote health and safety. So you would be on part of that team that helps write those policies and procedures. One thing I can think of is for a vending, just an example, vending machine. So as a school nurse, I forget what the program was called, but anyways, we had to evaluate what was actually in the vending machines. Like look at each item, the caloric intake, the amount of carbs, and then provide healthy replacement choices. Because of course, the children, they love what was in there, but it might not have been the healthiest food item. So we have to recommend items that would replace that. So again, look at the levels of prevention. Primary prevention, health promotion activities. You're teaching, providing that education, providing immunizations for the children. That's an example of primary. Secondary, you're screening for health problems. You're caring for ill or injured children and staff. And tertiary, caring for children with chronic health problems, health referrals, so that that continuity of care can be provided. All states have laws that requires that children receive immunizations or vaccinations. So you do have some exemptions. The school nurse must be up to date on the latest laws for immunizations for children in their own state and actively educate the parents about the benefits of, vaccinating their child. It's essentially up to them, but you're just providing the information there. You're not advocating, for a drug company or a rep or anything. You're just providing the information. Because secondary prevention involves early intervention for children when they need health care, it is the largest responsibility of the school nurse. This includes caring for ill or injured students and school employees. Yes, you have to help take care of the school employees also. You're going to be that go-to person. You can delegate tasks. They actually have medication assistant programs in some of the states where just a layperson will go through the educational piece and then the demonstration piece, and they're actually able to become medication assistants. Of course, we are mandated reporters. The school nurse is mandated by state law to report suspected cases of child abuse and neglect. These laws do differ from state to state. So a nurse who identifies a child who may be abused or receives information from a teacher or other staff, which they are mandated reporters also, that leads to the belief that a child has been abused, must contact the appropriate legal authorities and the school principals. It is not any other way. That's what has to happen. Using the nurse process, the school nurse gives nursing care related to tertiary prevention when working with children who have long-term or chronic illnesses or special needs. The goal for tertiary prevention is to assist the child to return to their highest level of functioning after injury or illness and to prevent complications. We talked about asthma and identifying those triggers. For example, chalk from blackboards, but now they pretty much use those dry erase, but sometimes those markers can emit a odor that could be a trigger. We identify mold and mildew in the school. Children with special needs in the school. These are just some different procedures that you might have to perform. Tracheostomy suctioning, IV administration. They may have ports where they have to get antibiotics or different medications throughout the school day. There are some children that have DNAR orders, and you have to provide care and be aware that that child has that. You want to also identify your own thoughts and feelings about that, but you have to be compliant with what they have in writing, which in that DNAR order. If it's there, you have to comply for providing care appropriately. So school nursing has evolved into a complex healthcare role. Sometimes we are faced with ethical dilemmas. If a child comes to you and asks about an abortion or Planned Parenthood, those can be some ethical examples. The future of school nursing is strong. So a challenge that districts and things have that they sometimes are faced with is being able to pay the school nurses, because deep on the population of students, they might need more than just one school nurse. But in some settings, in some schools and districts and communities, one nurse can work between 2 or 3 schools within that one day. But it just depends on the needs and the health of the student population. And this is it for reviewing concepts